morning, everyone. Anxiety during COVID times has been unprecedented. Now, with California fires, the need to have some home remedies for self healing is what the doctor has prescribed. We are going to discuss natural home anti anxiety remedies with Dr. Cheema, MD. Dr. Cheema is board certified physician offering holistic medical care in the Los Angeles area. She's board certified in anesthesia and pain management in Western medicine. Then she ventured to study healing practices from the East and completed further education in acupuncture, yoga, and aromatherapy. I am Amita from Narishta, a global platform for natural and holistic therapies. I am super excited to introduce all of you to Dr. Cheema, live from LA. Welcome, Dr. Cheema.
Hi, thank you so much for joining us today. So today we're going to talk about some techniques that you can use at home to help you relieve the stress that we've been having. And they're very simple tools that all of us can do on our own and promote our own natural healing. So many of us are aware of meditation as being very effective as a tool that can help us. And it sometimes seems very daunting. How do I meditate? Well, the most simple thing that you can do is actually just focus on your breath. And we're going to do a practice at the end of this and together do some of these breathing practices and help to promote more of our calming nervous system and help to promote our own healing. It's interesting because while we are aware that monks have been meditating for thousands of years and see how there's a spiritual benefit, we also have a lot of science now that shows how it can be extremely beneficial on a very physical level. So in 2010, there was a study that showed that people who meditated for 30 minutes a day for 8 weeks actually had a reduction in the gray matter in their brain in the amygdala area. And the amygdala is specifically related to fear and anxiety. And so it can actually change your physical being. So this is a huge, huge thing that now the science is showing the benefits of these simple exercises that you can do on your own. So many people ask, how does acupuncture work? So the Taoist monks used to do these standing meditations, and we're going to practice some of this at the end as well. They used to do standing meditations and they would feel the energy flow up and down their body. And what they found was that if people had stress or anxiety or an accident happened, like a car accident, or even just the natural process of aging, this would cause a block or a dam to form in the natural flow of energy going up and down their body. So with acupressure or acupuncture, we actually stimulate where that dam is and actually allow it to release and then promote the natural flow of chi or energy in your body again. But as I was saying before, there's a lot of science now that shows how this works even more. So one of the most physical things that you can see with acupuncture of how it works is works on fascia. So fascia is this white connective tissue fuzz that covers over the muscle layers. So it's kind of like when you have an orange and you peel open an orange and you see the individual orange slices, and then covering over all of that is a white fuzz. And it holds the whole orange together, but you also have the individual muscles. So we have the same thing, our individual muscles, but then we have this white fuzz of fascia connecting over all of them. So I describe it like a fishnet. And if you were to take a fishnet and anchor it down on 4 posts and then torque it on one side really, really tight, the other sides would get really tense as it's being pulled. If you release that knot, everything gets relaxed. So that's why when you put a needle in the leg, it can affect your low back. So something far away, when you put a needle there, it releases that knot and affects everything traveling up the muscles up to your back. And you can actually feel this in real time. And that was what first convinced me that this actually is something real, that some little tiny piece of metal or even just some acupressure can really cause a significant change. It has been shown to release natural endorphins. So they know this because when they've given people acupuncture and then they give them naloxone, which reverses your opioid effects on your body, it actually reverses the effects of the acupuncture. They've also shown that it works on a lot of other pain receptors, including adenosine, dopamine, promoting serotonin, and also on the endocannabinoid system. There's research now coming out about that. It also can improve your immune system, and they've seen this by looking at certain immunomodulator markers. Specifically, they're called interleukins. And I find this really fascinating that we can promote our immune system, especially in this time of COVID. What can we do naturally to help us that's so simple? Finally, they have shown that the acupuncture alters the nervous system. So they've put needles in and had patients go through a functional MRIs, and they show that it changes the synapses in the brain, the way that the nerves are firing. So when I was 6 years old, I remember learning that if you cut a nerve, that it doesn't grow back. And so now we know that that's actually not true. There's this concept called neuroplasticity, where the nerves actually can grow again, and they can grow new branches and new roots. And this is really, really fascinating that these little tiny things can do this. And even the acupressure can as well. So acupressure alchemy, how can we use this medicine from Eastern cultures and help us to heal? So as I was saying, there are studies that have shown the benefits. Specifically, what we know so far from Western science is that it can decrease vomiting and nausea and vomiting in patients who are pregnant and during chemotherapy. There have been studies specifically showing that it decreases pain with pelvic pain, with dysmenorrhea during labor, and also after trauma. It can improve your breathing, decreasing shortness of breath, and it can also help to relieve fatigue and reduce insomnia. And also on our psychological well-being, it can be a huge aid for that, including dementia. They also did studies with Iranian soldiers who used acupressure, and it showed to decrease their anxiety levels. So people who were under very high stress were able to have very good effect from this. So I included this picture of the ear because it's really fascinating. I think a lot of us have seen the pictures of the dolls with the acupuncture lines going up and down the body, and they're all over. And there's also points right in the ear. So it's kind of like reflexology, where you might have heard that, oh, I press on the bottom of the foot and it affects my shoulder, or it affects my colon. Well, the entire body is also located in the ear. And this diagram shows musculoskeletal points. If you Google ear acupuncture images, you're going to find other images where inside the ear, you'll actually also be able to stimulate internal organs. So like your heart, your lungs, your colon, your stomach. And on the outside of the ear is, I call it like the outer valley. So the inner valley and then the outer valley, though the outer valley has more of the bones and the musculoskeletal part of the body. So they found out about this because there was a French physician named Nogier, and he had a patient who had sciatica, and she burned her ear. I think she was doing like ear candling, from what I understand. And her sciatica, the pain going down her leg, went away completely. And so he started to study this and map out the systems, and looked into the ancient Chinese science as well, and saw that there's a whole system there that can be really used effectively for treatment. So,
sorry, I just wanted to ask, the auricular acupuncture right now is mainly used for the opioid withdrawal, or is it also being used for other ailments?
Oh yeah, you can use it for a lot of different things. Yeah, you can use it for, like I was saying, you can use it for ringing in the ears. There's points there. You can use it for stress. Like you can see how the whole head part here, like a lot of the this doesn't show it on this diagram, but a lot of psychological points are right in here, as well as and other parts of the ear as well. You can use it for smoking cessation. It's not always there. Sometimes it's really fascinating because I really believe that we're each individual and that we each need to find what works for us. And it's not as cookie cutter. But having said that, I've always been surprised when I do like a set point that's like for something, sometimes it really does help. And so, and if we can do anything, a lot of us are in quarantine still, or isolated and trying not to go out as much. So it may be difficult for you to come and see your acupuncturist, or to go to your physician and get help, or, and what are you going to do then? And maybe, you want something that you can do very quickly when you're on your own. And so I'm always surprised that these points can definitely help more than I've thought they could. Sometimes they get you to a certain point, and then until you can go and see your practitioner, then they can help to provide exactly what is the root cause and what is the actually something that will help you last even longer with relief. But I mean, I've been surprised, I have to say, and I think that I think that the times have changed, and we need to start using tools and empowering our own health as well. So yes, you can use these points, and sometimes a simple thing like just one or two things on your own can be really, really helpful. So these are a set of points that can be used specifically for acupressure for calming relief. And as I was saying just now, you can try these points. We're going to go through and do a meditation together and actually press on these points together. And I'm going to show you on myself where they are. But these diagram can definitely help you with picturing also like, oh, this is where I'm supposed to go. I really encourage you to practice on your own body to find where the points are that work for you. Because as I was saying, this is individual. If you're going to do this practice, you could go through these set of points every day, or you could pick 2 or 3. I recommend that you try and do this every day, and at least once a day, if not twice a day. If you're like me, if somebody tells me to do something every day, I'm probably going to do it half of the week. So I'd rather you just have that kind of goal set high. And if you're going to do it every day, it's not going to be too much for you. And I think that, it gives us something for our bodies to have self-care. And as I was saying, to promote our own healing. So what do? When you press on these points, you have a choice. I really think you should find what feels the best for you. Some of these points are going to be tender. That's okay. Some of them are going to feel good. And some of them you're just going to feel neutral on. And that's okay too. If it's tender, it may be like, whoa, what happened? Like, is there something wrong here? It just means that you might need some more attention and care there. If you can continue to press on the point gently, then please try to do so. When you're pressing on the point, so you can either just press. I'm going to show you on my wrist here, the pericardium 6 point, just for demo. So you can either just press like in gently. You can massage the point in either direction. Some practitioners say you have to go one direction or the other direction. I think you should find what's good for you, either counterclockwise or clockwise. You can also tap on them. Some of you may have heard of tapping. And so this is using the same principle as tapping. So you can either do breathing exercises as you're doing this, which we're going to practice, like do 3 to 5 rounds of deep belly breathing, full breaths. Or the other thing that I really promote doing is saying to yourself some compassion meditation, and finding some words, whatever words that ring true to you. So I have these words lifted here. May I be happy? May I be healthy? May I be safe? May I be free? And so the idea is that when we say these words of loving kindness to ourselves, we meet pain and suffering, and that promotes compassion, which opens our hearts and is extremely powerful. In fact, the heart in the Eastern medicine is the supreme controller, like the emperor, the empress. It's the one that nourishes and is the seat of how the entire body works. All of the energy lines work. So when we nourish our heart, it's extremely powerful. And it's funny when we say these words, sometimes it feels really cheesy or really trite or just like, oh, I'm just saying these words. But it took me a long time of saying these words, and then it started to really work. And sometimes now it's like very quickly when I say these words, I can feel an opening and a calmness come on. So it may feel like, why am I saying these words? But find the words that are right for you also. If these don't work, find what words work for you and feel nourishing. You may also find it beneficial to imagine giving this loving kindness to another individual, like a pet or somebody that's been there for you, and then feeling it for yourself, because it's often really hard for us to do this for ourselves. So let's start with our practice. So what we're going to do is just start sitting. And if you want, just really feel, you can also stand. Standing meditations are great too, especially when I'm really tired and I feel like I'm going to fall asleep. So if we all just start with feeling our sit bones or if you're sitting on the chair, feeling your feet. Oh, can we actually keep that slide up with the
Oh, sure,
point?
sure. No
Yeah,
worries, no
yeah,
worries.
thanks. Yeah. Just so when people come back, they can see it too. Okay, so
Absolutely.
we're going to start with sitting or standing. Wiggle your toes for a few moments and just really feel your feet on the earth. Press all the parts of your feet onto the earth. Your earth is your anchor. It really helps to connect us back so we're not floating, we're actually centered. Let your spine be tall from the base of the spine all the way up to the crown of the head. Let your shoulders drop down. Let your jaw relax and your tongue hang heavy. If you want to keep your gaze facing forward, feel free to do so. If you want to keep your eyes closed, that's fine too. And feel like you have warm liquid pools of water behind your eyes and the water streaming over the crown of your head, down your shoulders, down your arms, down to your feet. And take a deep breath in, a full breath, as much as you can through your nose, and exhale out your nose or your mouth. Inhale, feel that cool air coming in, and exhale, feel the warm air coming out. Inhale, cool air coming in, and exhale, warm air coming out. Now taking one hand to your heart and one hand to your belly. Feel your belly rise as you inhale. And on your exhale, let your belly relax. Inhale, fill the belly and the chest. Exhale, let the chest and the belly relax. Inhale, feel the breath coming up from the soles of the feet, the legs, the belly, the chest, up to the crown of the head. And exhale in reverse. Let the chest relax, the belly relax. Let the breath go down the legs through the feet. Inhale, up the soles of the feet, the legs, the belly, the chest, up to the crown of the head. And exhale in reverse. Let the chest relax, the belly relax, down the legs, through the feet. One more time. Let the breath come up through the feet, the legs, the belly, the chest, up to the crown of the head. And exhale in reverse, letting the breath travel down to the feet. From here, taking your palms together, rub your palms together, create a little warmth, little flame there. And then take those hands and place them over your eyes. And then gently take your fingertips. If you like, you can open your eyes to see what we're doing. You can also keep them closed and just listen. Take your fingertips and massage the top of your forehead. And then we're going to come over from the top of the ears, make a headband up to the top of the head, and feel around there. There's usually a point there where it kind of dips in and becomes a little valley there. This point is called governing vessel 20. It's also called 100 meetings. It takes the wisdom from the ancestors and brings it back to us. Our ancestors could be people like Harriet Tubman, a woman who has brought freedom to so many, or it could be something from nature, even the natural wisdom that we have of how the earth works, like the sun or the ocean. So again, tapping on this point or massaging in whichever direction, or just direct pressure right over there. And then we're going to come back down into the middle of the face, right between the eyebrows. This is a point called yin tong. It's also, a lot of us may have heard of this as the third eye in yoga. In the Taoist monks called this the upper dantian, the upper energy basin, where this was centered. I call it the unicorn point, right in the middle. And so I also work as an anesthesiologist, and I use this point a lot for patients when they're about to go off to dream world for their surgeries. And then let's come over with both hands over to the ears. So as you can see, as we were talking about the ear, there's 2 points specifically. If it's hard to find these points, what you can do is take your finger, don't go into where the Q-tip is, but into the part right outside where the Q-tip goes. I call this the inner valley, and just massage there. And this is getting all those internal organs. And then you can take both your fingers and go on both on the outside ridge, so the whole outer valley. And this is going to get all over the body. The 2 points that I listed there are Shenmen and point 0, which you can practice finding. Point 0 is a point that helps stimulate vagal tone, so increasing your calming nervous system, your parasympathetic. And Shenmen is my favorite point. It's for overall well-being. And for women, it actually comes from, it helps to promote well-being. Specifically, the energy goes from the pelvic area up to the heart, from the uterus up to the heart. So it's very, very nourishing for your core. Then we're going to come down onto the chest. So there's 2 points here called kidney 27. So if you come from where the sternoclavic, where the sternum and the clavicle join, and then just come about 2 thumb widths is how they describe it, or 2 inches, come out underneath the clavicle. And again, practice just seeing where it feels good to you. This point, kidney 27, is called the storehouse point. It's also, I call it Costco. It's like where you can go and get everything. So everything that's needed for your body, mind, and spirit is right here. And again, just taking some time, finding out, do you like to go clockwise, counterclockwise? Do you like to tap or just direct pressure here? And then coming down on the chest, right on either side of the heart, there's actually a series of points here that you can use. They're all on the kidney channel, and they're all for spirit survival, like spirit revival. They each have different nuances. Just find which ones, which set. Maybe there's a point here that feels really good and a point a little bit higher that feels really good, and just find which set of points feels really good for you. Just going up and down, trying to nourish. All of this area is just protecting the heart. And so we want to give it some time to be nourished and relax a little bit. It doesn't have to be so stressed all the time. And then I come down and massage all of my arms, giving it some loving kindness. And then I come over to the wrist, and there's a point called pericardium 6. I'll show you on this side. So the way you find this is you go 2 thumb widths from, this is the wrist crease, and go 2 thumb widths down, or about 2 inches. And you're going to feel as you come right, there's 2 tendons there. And as you come, it kind of almost like drops into a point. And so this one you can massage. It's pericardium 6 is very much known as a point for stress and for anti-nausea. You may have heard of AccuBands that people get from CVS, and they're used for seasickness, motion sickness. This actually helps to stimulate that same point. So again, telling ourselves, may we be happy, may we be healthy, may we be safe, may we be free. And then coming on the other side too. May we be happy, may we be healthy, may we be safe, may we be free. And then we're going to come down to the foot. So I'm going to angle my computer down a little bit more so you can see. So spleen 6 is on the leg, and it's also one of my favorite points. And so what you're going to do is take 4 of your fingers from the pinky to the index finger. From this bone is called the medial malleolus. From the center of that up the leg, and then just go, there's the tibia, you're going to go right behind it. There's a point that it just drops in. If this is confusing, just go up along the back of this bone, and you usually feel like it just kind of drops in. Again, each of you is going to be a little different. So find where you feel this, oh, this really needs some nourishing. So spleen 6 is also a 3 yin point, meaning So there are yin meridians, yin energy channels, and yang energy channels. And yin promotes your calming self, the nourishing side of you that needs more rest, your parasympathetic nervous system. And so three yin, so there are three meridians on the leg, kidney, liver, and spleen, that all promote that calming, and they all meet here. So this is an extremely nourishing point. It's a very good point for bringing us back down into our bodies, back down to connecting to the earth. It's a great point to use for stress and for people who've gone through any kind of trauma, whether it's a car accident or like if you just went through a grief, definitely during time of COVID, this is huge. And then on the bottom of the foot is a point called kidney 1. So I'm just going to show you very practical. So if you go on the bottom of the foot and you go between the second and third toes, and then just it drops down into like it just really just comes right there. It's about 1/3 of the way down. This is called kidney 1. Kidney 1 is a great point for calming the spirit. Also, your kidney channel is really what gives us our willpower. It is very innate for helping us face our fears, giving us courage. And this is the beginning of that channel. And now when I'm on the foot, I massage the entire foot. I definitely do this point and I do 3 rounds of that breath cycle, or I say my loving kindness to myself. And then I'll actually go through and make sure I massage all the toes and the inner arches of the foot and the sole of the feet. Our feet are like our antennae to connect us to the earth, and we need to give them some care. And again, any points on there that feel like they need some more care, just take your time with them. So the other thing you can do at home is you can apply heat to these points. You can get a thing called Tiger Warmer, which helps to heat up the points. And many of you who may have gone for acupuncture in a clinical office may have had Moxa, but it's going to be hard for you to do Moxa at home. So you can get Tiger Warmer and do that, or you can get something on Amazon called Bite Away. And it's like, it actually helps to take away the sting from insect bites. And you can use that on these acupressure points to help you get a little bit more relief. That stimulates the points and potentiates the action a little bit more.
That's beautiful. Should we move on? Or
Yeah. So if anyone has any questions or any other thoughts about this, please feel free to ask. Thank you.
Yes, we are open for questions. Anyone who's attending, I see quite a few people attending in Zoom. You can ask questions, put the questions in your chat window, and Dr. Cheema would be happy to answer your questions. So one of the comments I had was that depending on, like, there are so many different types of anxiety. I mean, one is anxiety, then is the stress, and the depression. So this would be like on a day-to-day anxiety level that you would have these points as self acupressure, or
I think these points are so powerful. They could be used for, I don't think you need to specify what type of anxiety in general. I think that they can be used for day to day and be extremely powerful. The body will know how to equilibrate, and it's not specific to, the anxiety was from the car accident, so I have to use these points, or the anxiety was due to something else. It's not so specific. I mean, these points can really be, and a lot of this I think we try and box in terminology a lot, and it doesn't have to be that specific.
So on a daily basis, just trigger these points just to make sure that we are happy, healthy, safe, and free, right? That would be your recommendation.
And yes, and they will help to promote your own healing. And I think doing the breathing, when I practice the breathing to help us go from the feet up the legs, up to the top of the head and back down, we're promoting that natural flow of energy going up and down. We get our chi, our energy, from the food we eat and from the air we breathe. And so bringing that energy into ourselves promotes that nourishment, promotes that healing.
So you will, what would you prescribe? Like start with a simple breathing exercise, like for 5 minutes, and then do these acupressure, or it could be any time of the day. Is there any sequence that we should follow?
I think you should find what works for you. I think you should, I mean, if it's hard to build a habit in the beginning and start doing something, it's very easy to be like, oh, I'm going to do that and then not do it. And especially now with COVID, like a lot of my friends and I are like, we don't do yoga anymore because we used to go to yoga class, and who wants to sit in front of the computer and do yoga? And so like, it takes like 3 to 6 months, the science has shown, to build a habit. So if you can do it like at a certain time, if that's what gets you to do it, like, okay, when I get up in the morning, I'm going to do this, or right before I go to bed, I'm going to do this. Usually, I think going to bed is a very hard time right now with COVID. Also, we're all on our phones and we're isolated. And so the anxiety peaks up. So if you can turn off your phone and spend a few minutes doing this, then, and do that every night, that might be what gets you to start doing this. So, but again, like if you find that you're at work or you're in the middle of the day between your Zoom meetings and stuff, and you need a break at lunch, then go for it, do it. I don't think there's a time to do this per se, like a prescription for it. I think it's really, how do we get ourselves on the train of building this habit now? Like we learned to brush our teeth when we were kids, but and we don't remember it, but it must have taken us a long time with our parents teaching us how to do that, right? And so, but now it's a habit. Now I can't imagine going through the day without having brushed my teeth in the morning. So and it seems like 3 to 6 months is a really long time. It seems very daunting. So some people give themselves like a month challenge and they cross off, or you might want to have some friends that you do this with, or check in with as a buddy, like, hey, did you do your breathing today? I really think the sleep time is like probably the best time to do it. And I have this habit also where I'm on my phone at night, and I've noticed that if I can keep my phone actually in another room for 30 minutes to an hour before I go to sleep, I do sleep better. So maybe allowing yourself to have some time to do this and put some music on. You can put some candles or aromatherapy in there. Give yourself some time to do this. This can be really beneficial.
It's interesting that we've been doing a lot of Ayurveda experts who come and talk about it. There's so many similarities to what you're talking about. Like specifically, they talk about rubbing the oil under your feet. If you're having problem with anxiety, and I'm looking at the similarities of what you said and what they say. It's like the two sciences are different, but they have a very similar principles. Any comments on that? Because I know you've studied everything.
I think there are a lot of similarities and a lot of nuances, and that are very much overlapping. And yet there's also like I said, nuances that each one has their own little take on things. Like I know in the Ayurvedic system, they talk more about air, and in the 5-element Chinese medicine, they talk about the element of metal. And so, but they usually, like when people study them, they say those are probably overlapping. So like there are differences, but also similarities. And I think it is very fascinating. I think it shows how we all have, I mean, just as we are human, we all have hearts and we all have lungs, but yet we all have our own preferences and likes. Like you might like chocolate ice cream and I might like vanilla, and so we have to find which one works for us. And so I do think that it's important to talk to people who have studied this, and while it is important to find what's right for you, there's a saying, you can only fly as high as your roots go deep. And so it is important to know the basis of this and to talk to people who have some experience and expertise on this, because you don't want it to also get watered down and washed out. And there is a value to, like, your roots go deep and you understand it, and then you can grow. We do evolve with science, and Eastern medicine evolves also. Like when you actually study the history of the points and the medicine, there was an evolution. They discovered this, and then they discovered there's another way to do things and another way to do things. It's just like Western science. Like, first we had medications, and then we discovered anesthesia, and then we could do more surgery, and then we discovered there's more medications, and now we know how to help people with cancer. And HIV is like, people can go and non-detectable viral loads now. That would never have been thought of when I was a kid, So like we evolve, and all of it evolves, but we have to know the basis of this, because we have to be careful not to water it down, like I said, and to devalue it. Yeah.
Okay. Any questions from people who are in Zoom session? We are open for questions before we wrap up. Okay. Should we go to the next slide, or?
I think that's it. It's just references. Yeah.
Yes, that's just references. And then we are. So I think everybody really understood what you were trying to say. Normally we have a lot of questions, but I don't see any questions coming up right now from the audience. So just to clarify, so the way you just explained about how you could do self-acupressure for anxiety, for other ailments, for instance, can you talk about that a little bit, maybe 1 minute or something, that, you know, people are suffering from so many other ailments? Can you self acupressure, or would you rather recommend go to
I think,
acupuncture?
yeah, I think there are points on there. There are definitely a set of points that I do for boosting your immune system. There's points that you can do like for back pain, like you see how the ear has so much in there. In addition, there's points to help for sleep, and I mean you can definitely find a set of points. I think that you can definitely find these points and talk to somebody and do these things at home, but I think, as I was saying before, you get to a point where you might need some more expertise. And I think, I mean, I do online consultations also, which is great with Zoom now. It's so cool that I think that actually this pandemic has moved us forward a little bit, because you can actually do healing one-on-one and do a consultation and find out what is it that is the root cause of what you're continuing to have this concern and this ailment, this dis-ease. The idea behind this is that we have something at the root that is causing this, and it's like an onion, and we peel open the layers of an onion. And so first you shut off one thing, and then you shut off another thing, and then you get to the root part where you can heal on your own. And our goal is to get you to actually be able to live a full life on your own, not that you come to the practitioner all the time, but for you to be able to live, and maybe come for every now and then to have a consultation or a tune-up. I mean, I think it's kind of similar with Ayurvedic medicine. Like, you do this, and then depending on the season change or something happens in your life, you come and you might need to change your regimen for the oils that you use or the herbs that you take. And so I think that it's important to have that one-on-one, either if you can't come to actually have a treatment, then on a Zoom, like a wellness consultation, or, but definitely like use these points, because it's amazing how they are very powerful. And, you know, if you need something more to get you to the next level, you have that available with a one-on-one with somebody.
Sure, sure. And our email and website is right here. If you want to get in touch with Dr. Cheema, please send us an email and we will connect you with her. No problem. And if you wanted any consultations, let us know and we'll connect. And in October we are launching group workshops as well. So maybe Dr. Cheema, we would work with Dr. Cheema to come back and give us the self acupressure for other more detail as well. Any final comments before we wrap up, Dr. Cheema?
No, thank you so much for having me today. This was a pleasure, and I really enjoyed it as well. And I hope that others find some relief and some ways to help us get through these challenging times.
Thank you so much. And thank you everyone for attending our sessions. Please give us the feedback, how we are doing, and help us share these natural therapies with your loved ones. Signing off now. Have a great weekend. Bye-bye.